As someone who has both suffered and effectively managed hip pain from FAI and labral tears, I can tell you there is hope for a non-surgical solution. In this video, I'm going to outline a 4-week plan that will help you improve and manage your hip pain so you can avoid surgery and live an active life. But first, comment down below with your hip pain experience. Hip impingement, or FAI, and labral tears are common causes of pain in the groin and front of the hip, especially when flexing and rotating the hip. The key to improving and managing this condition is to avoid aggravating activities and gradually introduce more and more complex and demanding movement. Trying to execute an advanced or complex therapeutic exercise plan often results in re-irritation of the injured tissues, which can make it seem like an answer to your pain is hopeless. Don't worry, I'm going to outline what exercises you should be doing and, more importantly, how to progress them safely. This is exactly how I structured my 4-week Pain to Perform FAI and labral tears program. More on that later. In the first phase, we have to establish a baseline of core control and hip flexibility. These are common issues shown to be present in many cases of FAI and labral tears, and are unlikely to irritate the tissues in the hip. Establishing a baseline of transversus abdominis control is essential to restore lumbopelvic stability. Think of it as the platform that your hips have to perform on. Without a solid platform, the hips cannot perform optimally. Check out the video I made on this muscle in the description below. Additionally, we want to make sure we have sufficient flexibility of the hip rotators, namely the piriformis and the hamstring muscles. For the second phase, we continue improving these aspects and begin to incorporate hip mobilizations and simple hip rotation control in pain-free ranges of motion. Posterior and lateral hip capsule mobilizations are started, which will allow the hip joint to move the way it's supposed to. Clamshell variations are added at this point once you have more flexibility of the hip rotators, stability in the lumbopelvic region, and mobility of the hip joint. Moving on to phase 3, we begin to add strength exercises for the hip abductors and the gluteus maximus. Simple bridging variations are incredibly effective exercises to both monitor symptoms, to ensure you stay in a pain-free range of motion, and strengthen these hip muscles. More advanced core control exercises get added involving lumbopelvic stabilization while the limbs are moving. A dead bug is a good example of this. It allows the focus to continue to be on abdominal activation, but adds a layer of complexity. Finally, in phase 4, we begin to integrate all of the progress you've made in the previous phases into more functional movements. This involves controlled hip circles, exploring a wide range of pain-free motions you now have access to. More difficult strength exercises are added, as well as several weight-bearing hip control exercises such as a single-leg hip hinge. Following these guidelines is a good start when trying to build your own recovery regimen. However, if you're looking for a program proven to improve hip pain from FAI and labral tears that takes you step by step through specific exercises, as well as the phases I mentioned in this video, look no further than Pain to Perform FAI and labral tears. Learn more about this revolutionary program by clicking the link in the description below. And don't forget to tell us your hip impingement story in the comments below. Thanks for watching.